Do you know what sleep apnea is and how it can affect your health? Sleep apnea is more than just an inconvenient interruption to a good night's sleep. It's a potentially serious sleep disorder that can significantly impact your overall health. Imagine this. You're sleeping peacefully, but then your breathing repeatedly stops and starts without you even realizing it. Frightening, isn't it? This is the reality for those grappling with sleep apnea. Now, you might be wondering what causes these breathing interruptions. Well, there are actually two main types of sleep apnea, obstructive and central. Each has its own unique causes and symptoms, adding layers of complexity to this disorder. If left untreated, sleep apnea can pave the way for a host of health complications, from high blood pressure to heart problems. It's not just about the quality of sleep, it's about the quality of life. In this video, we will delve deeper into the two main types of sleep apnea, its symptoms and risk factors. So stick around and let's unravel the mystery of sleep apnea together. First, we focus on obstructive sleep apnea, the more common form of this condition. Imagine a scenario where your throat muscles take a break, intermittently relaxing while you're off in dreamland. This relaxation isn't as peaceful as it sounds because it blocks your airway, turning your quiet sleep into a wrestling match for breath. This is the reality for those with obstructive sleep apnea. Now, how would you know if you or someone else is dealing with this? Well, the signs are hard to ignore. The most noticeable symptom is loud snoring, often described as a freight train rumbling through the bedroom. However, not every snore is a cause for alarm. It's the pattern that matters. Normal snoring doesn't come with silent periods of breathing interruptions followed by gasps for air. And then there's daytime fatigue. Ever felt like you could nap for hours even after a full night's sleep? That's another sign. With obstructive sleep apnea, your sleep is fragmented, leaving you exhausted during the day. This can lead to irritability, mood swings, and even affect your concentration. But who's at risk, you ask? Well, anyone can develop obstructive sleep apnea, but certain factors increase the likelihood. Obesity is a significant risk factor, as the excess fat tissue can thicken the wall of the windpipe, making it narrower and harder for air to get through. Even the natural structure of your airway can put you at risk. If you have a naturally narrow throat or enlarged tonsils or adenoids, you could be more susceptible to the condition. Obstructive sleep apnea isn't just about loud snoring and interrupted sleep. It's a serious condition that could have significant impacts on your health and quality of life. It's crucial to be aware of the symptoms and risk factors and to seek medical help if you suspect you or a loved one might be affected. Remember, although snoring can be a key sign, not everyone who snores has this type of sleep apnea. Next, we explore central sleep apnea, a less common type of this disorder. Unlike its counterpart, obstructive sleep apnea, central sleep apnea is not caused by a physical blockage in the airway. Instead, it stems from a communication problem, where the brain fails to send the right signals to the muscles that control your breathing. Imagine your brain as a conductor of an orchestra, and the muscles that control your breathing as the musicians. In central sleep apnea, the conductor, your brain, fails to give the right cues to the musicians, causing an interruption in the beautiful symphony of your sleep. The symptoms of central sleep apnea can be quite elusive. They include shortness of breath, which can often wake you up, causing a fragmented and unsatisfying sleep. Insomnia, or the inability to fall asleep, and hypersomnia, excessive sleepiness during the day, are other telltale signs. You may also experience difficulty concentrating due to the lack of restful sleep. It's like trying to read a book while your eyes are half closed. Quite a challenge, isn't it? Now, let's talk risk factors. Central sleep apnea is a bit picky. It's more likely to occur in older adults and individuals with heart disorders. Certain medications, particularly opioids, can also increase the risk of developing this condition. But here's an interesting fact. While the sound of snoring can be a telltale sign of obstructive sleep apnea, it's not a common symptom of central sleep apnea. So, even if you're not shaking the walls with your snores, it doesn't mean you're off the hook. Unlike obstructive sleep apnea, snoring is not a common symptom of central sleep apnea. So if you're experiencing some of the symptoms we've discussed, it may be time to seek medical advice. After all, a good night's sleep is not just a luxury, it's a necessity. So, what happens if sleep apnea goes untreated? Well, the complications can be far-reaching and potentially severe, impacting various aspects of your health. Firstly, sleep apnea can contribute to high blood pressure. Picture this. Each time your breathing pauses during sleep, your brain goes into emergency mode, releasing stress hormones. These hormones raise your blood pressure levels, and over time, this can lead to hypertension. Next on the list are heart problems. Both types of sleep apnea, obstructive and central, can increase the likelihood of recurrent heart attacks, abnormal heartbeats, and strokes. This is due to the sudden drops in blood oxygen levels that occur during sleep apnea episodes, putting a strain on your cardiovascular system. Then there's type 2 diabetes. Studies have shown a link between sleep apnea and this form of diabetes. People with untreated sleep apnea have a higher risk of developing insulin resistance, a precursor to type 2 diabetes. Don't forget about metabolic syndrome either. This cluster of conditions includes increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Together, they can increase your risk of heart disease, stroke, and type 2 diabetes, and sleep apnea is often associated with it. Lastly, sleep apnea can also lead to difficulties with concentration and mood. The frequent disruptions in sleep can leave you feeling fatigued during the day, making it harder to focus on tasks. It can also lead to mood swings, irritability, and even depression. So, you see, sleep apnea is not just about snoring or feeling tired. The stakes are much higher, and it's essential to seek medical help if you suspect you have this condition. Remember, early detection and treatment can prevent these complications and significantly improve your quality of life. Sleep apnea is not just about disturbed sleep, it's a condition that can have serious implications on your overall health. Now that we understand sleep apnea, let's look at the available treatments. Treating sleep apnea is not just about ensuring a good night's sleep, but it's also about reducing the risk of potential complications, such as high blood pressure and heart problems. Treatment options range from lifestyle changes to therapies, and even surgery in severe cases. Starting with lifestyle changes, these are often the first line of treatment. For those who are overweight or obese, weight loss can significantly improve or even eliminate sleep apnea symptoms. Regular physical activity, such as walking or swimming, can also help. Additionally, quitting smoking can reduce airway inflammation and improve sleep apnea, while avoiding alcohol, sedatives, and certain medications can prevent your throat muscles from relaxing excessively. If lifestyle changes aren't enough, various therapies come into play. Continuous positive airway pressure, or CPAP therapy, is the most common. In this treatment, a machine delivers air pressure through a mask while you sleep. The pressure prevents your airway from collapsing, thereby treating obstructive sleep apnea. There are also different types of oral devices designed to keep your throat open. These devices, which you wear during sleep, can help reduce snoring and mild to moderate sleep apnea. In severe cases, or when other treatments haven't worked, surgery might be recommended. This could involve removing tissue from the back of your throat, shrinking tissue with radiofrequency energy, or repositioning your jaw, among others. Each surgical option has its potential benefits and risks, which should be discussed thoroughly with your doctor. Lastly, for those with central sleep apnea, treatment often involves managing the underlying condition, whether it's heart disease, a neurological disorder, or some other health issue. Medications might also be prescribed to stimulate breathing. Remember, the right treatment for you will depend on the type of sleep apnea you have, its severity, and your overall health. To sum up, sleep apnea is a serious sleep disorder that requires attention. We've delved into the two main types, obstructive and central sleep apnea. Each has distinctive characteristics, but both involve dangerous disruptions in your breathing as you sleep. Symptoms can range from loud snoring to daytime fatigue and irritability. Risk factors for obstructive sleep apnea often include obesity and a narrow airway, while central sleep apnea can stem from certain medical conditions. We also touched upon the complications of sleep apnea, which extend beyond mere sleep disruption. The condition can lead to high blood pressure, heart problems, and difficulties with concentration and mood changes. But it doesn't stop there. We explored various treatment options that can help manage this condition, reduce its impact, and improve your quality of life. The journey to better sleep and health can be a challenging one, but it's worth it. If you or a loved one is experiencing symptoms of sleep apnea, don't ignore them. Reach out to a healthcare provider. Remember, your health is your wealth.